This medication is used to treat arthritis of the knees. It reduces pain, swelling, and joint stiffness and helps to improve your ability to move and flex the joint. If you are treating a chronic condition such as arthritis, ask your doctor about non-drug treatments and/or using other medications to treat your pain. Before using Ziclopro, make sure to read the medication guide and the patient information leaflet from your pharmacist. This medication is for use on the skin only. Apply as directed by your doctor, usually 40 drops for each knee 4 times daily. The dosage is based on your medical condition and response to treatment. When applying the medication, make sure to spread it evenly around the front, back, and sides of the knee. Let it dry for several minutes and avoid touching it until it is completely dry. Remember to wash your hands before and after applying the medication and avoid getting it in your eyes, nose, or mouth. Use this medication regularly at evenly spaced intervals to get the most benefit from it. Do not use it more often or for longer than prescribed. For certain conditions, it may take up to 2 weeks of using this drug regularly until you get the full benefit. If you are using this drug as needed, remember to use it at the first signs of pain. If your condition worsens, make sure to consult your doctor. Some common side effects of Ziclopro: 1.5% to 0.025% topical, solution and cream. Non-steroidal anti-inflammatory agents, NSAID, topical, are skin irritation, drowsiness, or dizziness. If these effects persist or worsen, it's important to contact your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. Ziclopro may also raise your blood pressure, so it's important to monitor your blood pressure regularly and inform your doctor if it becomes elevated. Be sure to tell your doctor immediately if you experience any serious side effects, such as signs of kidney problems or symptoms of heart failure. In rare cases, this drug may cause serious liver disease, so it's important to seek medical help if you experience symptoms such as persistent nausea or vomiting, loss of appetite, or yellowing of the eyes or skin. While serious allergic reactions are rare, it's important to seek medical help if you experience symptoms such as fever, rash, swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects. If you are in the US, you can call your doctor for medical advice about side effects, or report them to the FDA. In Canada, you can also call your doctor for medical advice about side effects, or report them to Health Canada. Non-steroidal anti-inflammatory drugs, like Ziclopro, may rarely increase the risk for a heart attack or stroke, especially if used for a long time. The risk may be greater in older adults or those with heart disease, high blood pressure, or diabetes. It's important to avoid using this medication right before or after heart bypass surgery. Additionally, Ziclopro may rarely cause serious bleeding from the stomach or intestines, especially in older adults. Stop using this medication and seek medical help right away if you experience severe stomach pain, black or bloody stools, vomit that looks like coffee grounds, chest pain, shortness of breath, unusual sweating, confusion, weakness on one side of the body, sudden vision changes, or trouble speaking. It's important to talk with your doctor or pharmacist about the benefits and risks of using Ziclopro to ensure it is the right medication for you. Before using Ziclopro: 1.5% to 0.025% topical, solution and cream, make sure to let your doctor know if you are allergic to it, aspirin, or other similar medications. Also, inform your doctor of any medical history of asthma, liver disease, heart disease, high blood pressure, or other health conditions. Using this medication may cause dizziness or drowsiness, especially when combined with alcohol or marijuana. It's important to avoid activities that require alertness until you can do them safely. Additionally, daily use of alcohol and tobacco while taking this medication can increase the risk of stomach bleeding, so it's best to limit alcohol and stop smoking. Be cautious of sun exposure while using this medication, as it may make the treated area more sensitive to the sun. It's best to limit time in the sun, avoid tanning booths and sun lamps, and wear protective clothing outdoors. If you do get sunburned or have skin blisters/redness, be sure to inform your doctor right away. If you are an older adult, you may be at greater risk for certain side effects while using this medication, such as stomach/intestinal bleeding, kidney problems, heart attack, and stroke. If you are a woman of childbearing age, talk to your doctor about the benefits and risks of using this medication. It's important to inform your doctor if you are pregnant or planning to become pregnant, as this medication may harm an unborn baby and cause problems with normal labor/delivery. Additionally, consult your doctor before breastfeeding, as it is unknown if this form of diclofenac passes into breast milk. It's important to be aware of potential drug interactions with Ziclopro 1.5% to 0.025% topical, solution and cream. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug include aliskiren, ACE inhibitors, angiotensin II receptor blockers, citalopram, corticosteroids, lithium, methotrexate, and water pills, diuretics such as furosemide. This medication may also increase the risk of bleeding when used with other drugs that also may cause bleeding, such as antiplatelet drugs and blood thinners. Be sure to check all prescription and non-prescription medicine labels carefully, as many medications contain pain relievers/fever reducers that are similar to diclofenac and may increase your risk of side effects if taken together. If your doctor has directed you to take low-dose aspirin to prevent heart attack or stroke, you should continue taking it unless your doctor instructs you otherwise. If this medication is swallowed, it can be harmful. In case of overdose with serious symptoms such as passing out or trouble breathing, it is important to seek immediate medical help by calling 911 or contacting a poison control center. Symptoms of overdose may include severe stomach pain, changes in the amount of urine, and slow or shallow breathing. It's important not to share this medication with others. While using this medication, it's important to have lab and/or medical tests done, such as blood pressure, complete blood count, and liver/kidney function. Make sure to keep all medical and lab appointments and consult your doctor for more details. In addition to taking this medication, making lifestyle changes such as weight loss if needed, and doing strengthening/conditioning exercises may help improve your flexibility and joint function. It's important to consult your doctor for specific instructions on these lifestyle changes. If you forget to use a dose, use it as soon as you remember. If it's close to your next dose, just skip the missed one and use your next dose at the regular time. Don't take double the dose to make up for the missed one. Make sure to store Ziclopro 1.5% to 0.025% topical, solution and cream non-steroidal anti-inflammatory agents, NSAID, topical at room temperature and keep it out of reach of children and pets. Do not dispose of this medication by flushing it down the toilet or pouring it into a drain unless instructed to do so. When it is expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.